Hello, can you
Hello.
hear me? If can hear me, type
Yes.
555. Can hear me, type 555. Someone say something already. Oh, Yitling. Okay, like Yitling, like.
Yes. Yeah.
So fast,
Hi.
ah?
Waiting.
Okay, come.
Yeah. I'm supposed to come back here to update what happens the last 3 days. That I've taken the porridge.
Yes, come.
Okay. The first day it's a bit tough. My 3 meals for the last 3 days are all porridge. Okay.
Yeah, it's
First day
fine.
is a bit tough. Yeah. Then the second day morning, I still feel a little bit difficult. But then I think because the second day I get up very early and then I go out, bringing my porridge with me. Then after that, the afternoon I get very hungry and at afternoon I could eat.
Yeah,
Even on the dinner I could eat, but not excessive.
right.
When it comes to today, which is the third day, I feel
Yeah.
that yeah, I think my appetite is coming.
Wow.
It's just
So
that
that
I
means,
find
yeah.
mm,
Continue.
yeah, it's just that I find that still cannot eat a lot. But the resistance to eat is almost gone. Yeah.
Ah, fantastic. This is
Yeah.
what we look for. That means now, compared
Yeah.
to last time, right? Before we talk, now you start to have that craving for food. You will feel hungry, right? You have those desire to eat already, right?
Yeah. Yeah. Or maybe because I think that time, Frank, actually, on Wednesday, I was being told that they found that I have H. pylori.
Right. H.
Uh,
pylori is all
yeah.
because your gastric juice is too weak, so it cannot
Mm,
kill those bacteria. So it's not of a concern when you eat enough. Your body,
mm-hmm,
because now the thing is, you are not even eating enough. Why I want to produce so many gastric to digest, nothing to digest.
mm,
So because you don't have so much of gastric, the bacteria inside the food, like H. pylori,
mm,
it will start to, start happening and having fun in your body. But when you start to
mm,
have the craving, you start to eat more, you do not have the
mm,
resistance of eating already, right? You will start to
mm,
eat
mm,
more and more. You need to consciously to eat more and more. And
mm, mm,
very soon, H. pylori will disappear.
mm, 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 mm. Okay.
Okay?
But okay, but then I would like to ask,
Sure.
maybe because the last 2 weeks I haven't been really managed to eat, and
Right.
also earlier I mentioned that I have always this tingling effect of the in the head, so
Yeah.
now I still find myself like today I try to read a little bit more on the computer. Then I start to find just now I feel my stomach is like not very nice already. Then I have this heavy headache and heavy tingling thing coming back. You see.
Yeah.
So I'm
Yeah.
actually not fit yet to any work yet. Is it?
Yeah, you get some rest because like 3 days ago, right?
Mm,
Whatever I advice give to you, right? It just to
mm,
open up the appetite, remove the resistance of eating, so your body can
mm,
start to jump start again. So this is the first step.
mm, mm,
Continue to do this. Maybe in a week time,
mm.
right? You will start to see your body feel better already.
So you mean I still continue to take the porridge,
You can, if you can take rice, is also okay. It depends what work
soft
better for
rice,
you.
right?
Yeah, right. White rice is
Soft rice
better
should
for
be
you.
okay lah.
Yeah, you can take
Mm,
softer rice if you like to eat with some sometimes whatever food you come that you like to eat, rice make it softer as long as you bite is okay because the good thing about softer rice is easier to digest and it's more
mm,
feeling compared to the porridge. But
mm,
porridge
mm,
is good to open up the appetite to get rid of the
mm.
resisting thing.
Okay.
Yeah, so
So,
now you can play around. Just
mm,
make sure if you eat rice,
mm,
suddenly you don't have appetite already, then you continue to take some
go
porridge.
back to the porridge now. I
Yeah.
see. What about the breakfast? I still have to do that. Is it with the rice or it can be something else?
Again, can you repeat again? You speak
What
a little
about
bit
the
slower.
breakfast? Sorry, is it a bit soft? What about the breakfast? I'm saying, what about the breakfast? So I still have to continue with the rice base, or it can be anything else already now, the breakfast.
Okay. If your lunch and dinner time you don't have much chance to take rice or porridge, right? Then morning I will
Mm,
still encourage you to take porridge first. At least in the morning, you have some calories intake to jumpstart the
mm,
system
mm,
first. Because
mm.
sometimes
But
when
if
you go outside to work, right?
mm,
Then
mm,
lunch you only eat bihun, you eat some
mm,
salad,
mm,
don't have
mm,
much
mm,
choice, right? Then morning
mm.
become important.
Oh, but I have been eating rice now for lunch and dinner for 1 week already.
Okay,
Then
that's okay.
mm,
That's okay.
then
Just
the breakfast is
remember,
okay lah.
yeah, just
Uh,
remember as per last conversation, half a bowl is not enough a day. You now if can you go up to two. So if cannot go out to two, right? At least you try porridge is fine.
okay, okay,
Yeah,
okay. So at least 1 bowl per day lah.
yeah,
Minimum
yeah,
half plus half. Yeah.
yeah,
Okay,
yeah,
okay. Okay, so I have another question is that actually because I like I say I went for the Scoopy and then I have also the CT scan then because
yeah,
my there was some twisting in my colon so they can't see so I have to do a CT scan. So out from the CT scan actually there's nothing much on the colon it's just a redundant colon. But
yeah,
from the results also they mentioned I have in the uterus I have some fibroid, two in the anterior wall, the right lateral wall. Then I have small cysts on the left and right of my ovary. Then I have cysts in my lower pole of the right kidney. And all these, there are so many cysts and fibroid. How do I get rid of it? What kind of patch that can help me to do that?
Okay, now once your appetite get better, when you start to
Mm,
able to sweat more often, when
mm-hmm,
you do not you always eat like normal, you do not have this kind of giddiness already, right?
mm, mm, mm,
Then your blood circulation start to move. All these
mm,
polyps lah, fibroid will start to disappear. The reason you have all these kind of polyps or fibroid
mm,
all around the
mm-hmm,
body is
mm-hmm,
because the qi is not
mm,
circulating.
mm-mm.
You are not eating
Okay.
enough. So when
Mm-mm.
your appetite get better, the giddiness will first go away first,
Yeah.
and all these things will
Mm-mm.
start to it will start to disappear.
I see.
Yeah, don't
Okay.
need to
Okay.
worry. Don't need to worry. All these tumors is only a symptoms. It's not a problems.
Okay. Okay. Understand. Understand. A relief to me.
Yeah. Okay. First of all, do you think
Yeah.
it's
Yeah.
amazing? Just by switching a little bit of diet for 3 days, you can start to
Yeah.
feel the internal different, the thriving
Yes. Yes.
force
Yes.
in your body. He
Yeah.
really
Yeah.
wants
Yeah.
something to help, right?
Yeah.
It's how
Yeah. Yeah.
amazing.
Yeah. But initially, really, it's so tough. I look at the food. I just resist to eat.
Yeah, you are right.
Yeah. Mm-mm.
That is always the case. So this is why I tell you, you have to get rid of the resistance. Just give me 2 weeks
Mm.
time. Just follow what I say, and have
Mm.
faith that you just need to go. You just need to go past those mental resistance. Suddenly you feel like
Mm.
it's okay, ma. What I need to so afraid about? It's only porridge, only rice. Well, now I start
Yeah,
to get
it's
hungry.
not the rice and the porridge. It was just then the gastric that really you eat also feel discomfort. I don't eat also discomfort. It was like that feeling the should I eat or should I not eat?
Yeah.
Mm, mm,
Good. I'm glad that you make that move. It will get better from today onwards.
okay.
Yeah.
Yeah. Because the last I mean the last the Monday when you tell me you were so confident, so I also very confident. Until you tell me you said 3 days come and you tell me you're sorry.
Amazing, right? Amazing, right?
Yeah.
So, okay, if you want to know why I know it's 3 days,
Mm-hmm.
our body take about five days for the digestive tract, the lining to repair.
Friday.
Yeah,
Mm,
5 days, 5 to 7 days. So this is why it will
mm,
take almost about 3 days. You will start to see something already. One. So this is why I say
mm,
until next week. Next week, if you continue what you have
mm.
been doing until next week, right? All the giddiness, it will start to go away.
Yeah, the
And
giddiness is still there. It comes
yeah,
back, in a sense, because after
yeah.
all this
Yeah,
tough stomach
because
discomfort.
now the chi haven't hit there yet. Now it's only repairing the digestive system. Next week when you
Mm,
come, next week Thursday you come, you will say, hey, really the giddiness really still have but
mm,
very little already.
mm.
Yeah, next Thursday
Okay.
you come.
Okay. Okay.
Okay, thank you
Okay. Thank you. Thanks.
thank
Yeah.
you.
Thank you.
Amazing So for those of you who don't know what happened, so Itling came on I think Tuesday or Monday, I've forgotten. I think Tuesday.
Monday.
So Monday, okay, Monday.
Yeah.
So
Mm,
and then Yiling was saying that he went to check out and then not very good. The intestine, the stomach got inflamed, and he keep on got the 胃灼热. That means the acid reflux. The stomach is very hot, and the heart is very like congestion, not very comfortable, and then get very giddy. It's like the body is not in the right shape. So and then he go to see doctors. nothing is being done. But then he ended up going to the endoscopy, colonoscopy, and the doctor said the colon is twisted, and the stomach is inflamed. Then I say, of course lah, if you got acid reflux, you don't feel good at your stomach, of course stomach inflamed lah. You cannot be now your stomach not comfortable and then do the scope and then they say your stomach is perfect, no inflammation. How can it be? It's just like now I feel pain on my elbow, and then you do a scope and then to say that the elbow got inflammation. It's like telling me my mother is a woman, you know. So this is how I make fun of the doctors. So I say it's definitely like this. And then I say the reason why you have all this problem is all start with the digestive system is being weak. You are not eating enough, and then the gastric is not secreting good enough, and then the gas start to disturb the heart. And when the intestine got nothing to absorb, when your body really need the nutrients, right, it will start to squeeze. It's just like a toothpaste. See a toothpaste, right? Like we'll always use up the toothpaste, right? Until the very little, then we will try to twist it, right? Try to twist it, to squeeze all the toothpaste. Do you guys do that also? Like at the very end, you want to twist the toothpaste to squeeze every single bit of the toothpaste. Anyone did like that? If yes, that 555. Anyone do like that? If yes, that 555. So same thing like human body. Okay, so whatever you do with your second nature, it happened in your human body also. So in the intestine, it will start to twist a little bit to squeeze more because the food is so little, so it cannot cover up the intestine. So it had to try to twist it to try to squeeze the nutrient out of the food that you take. This is how noble our human body is, and how brilliant our our body system is. You see, even you eat very little, right? He will still try his very best to make sure he squeeze every single thing out of this very limited food to keep your body survive. You see, this is why is really it's really stupid when we don't know about our human body and then we let our doctors to do whatever they want, because this body have been doing whatever 100% beyond the human logical mind to do to serve us already, but we decided to ignore this. We don't recognize them. We just want to listen to doctors because they have studied for 7 years. This way we want to change this. So and then I said, don't worry, your problems are kacang putih. You start to take. He said he start to take rice already. I said, okay, take rice, okay. How many bowl? Maximum half a bowl a day for the past maybe 2 months at least. Not really resistant of eating one. I say, now now at this juncture already, if you want to continue to follow doctor, the colonoscopy lah, the endoscopy lah, the doctor is going to find something. There's a tumor, there's a fibroid, and they ask you to do some biopsy, and they ask you to do some CT scan, MRI, chemo, radio, and then you go no end already. Or you want to follow my advice first. No matter what, try to push through the resistance of eating white rice. Go and eat. Even force yourself to eat is fine. You can start to take some porridge, add some marmite to open out the appetite. In the beginning, it's going to be very difficult, but just in the 3 days time, you're going to see you start to feel hungry already, the appetite come back already. So Eating came back 3 days later with the news just now. Yeah, now I can feel I got the appetite already. I have the appetite. I will feel hungry already. I will eat already. Amazing, right? Only 3 days. A little slight change in the mindset, a little bit slight change in your diet, you see so much of thing has improved in just 3 days. You can feel the kind of determination for this body to heal for you, you know. Guys, you think amazing or not, huh? Huh? And what I say is 3 days is because our human body is not difficult to jumpstart. Like for example, like you have a car, right? If the petrol has runs out, okay, you need to take maybe 5 minutes to pump the petrol, okay, to fill out the tank, right? But if the battery is dead, you just need to jumpstart a few seconds only, and then you are able to jumpstart the battery already. So you have been eating the food, so your nutrient is not enough, but it's still okay. But it's the entire digestive system has stopped working already because of the deprivation of the nutrient. So with the patch, I'm so confident. If without the patch, I tell you, maybe 1 to 2 weeks time, son. It's very slow. But with live it, I'm so confident. From 2-3 weeks, you can cut down to 3 days. So you see 3 days, see result already. Amazing or not? This is how when you have this kind of technology, like live wave, right? With a little bit of understanding of human body, we can heal everyone. Start from ourselves. Amazing or not, guys? Okay, come let me continue. Okay, let me see. Hello, Jinlong Susu. I'm Michaela. Can I open? Oh, sure. Sure. Michaela, 来, Gimsun. You are Gimsun. Okay, 来, Michaela.
Hello.
Hello, Michaela. How are you?
Good.
Good, good. How is your father doing?
Good.
Good.
His blood clot no more.
Wow, congratulations. Oh.
His heart also getting better.
His heart also getting better already, okay? Is
Uh,
he? Yeah.
His memory also quite good already.
Oh, memory also getting better, okay? Congratulations. And then?
Yesterday, he went for doctor appointment.
Yeah.
And doctor said that his improvement is very quick.
Very quick improvement, okay? Nice. You have something else? Okay, or Michaela, can you briefly tell us what happened to your father for the past few months? Because there are some uncle auntie here, they don't know or they've forgotten already.
Okay. My father was playing basketball one day. He fell down and he hit his head, and there was a blood clot, and there was no pulse. And then, luckily, a doctor did CPR for him, and he went to hospital. What?
Okay. Hello, are you still on the line?
Yes.
Okay, so got the blood clot and then go to the hospital. Did your father do any surgery?
Yes. No, but then after on, only the heart got put like a device.
Yeah, okay, right.
He did
And
one surgery.
right, the surgery to put, is it the pacemaker? The pacemaker, right? Or the stents?
Something like that.
Something like that. Okay. And then when he is in hospital, and are you worried about your father?
Yeah.
Yeah, and when your father is in hospital, is he able to speak? Is he able to think? Or that time he got no more memory and
No
he
more
can
memory.
memory, right? And after patching for how many weeks or months, and then you start to see some changes?
3 days.
After 3 days,
Yeah.
Yeah, and 3 days later, what are the improvement that your father can start to remember things, start to speak better already?
He can remember things.
Wow. And from that time until now is how many months already?
About 3 months.
About 3 months already, So 3 months later, your father now went to the checkup again. The doctor said the recovery is very fast.
Yes.
So next time, if your father tell you, Michaela, Papa is going to play basketball So what would you say?
I will say take care and
Yes, please take care, Papa. You still got a young, good daughter waiting for you to come home.
but now he cannot play.
I see. Because of?
His heart.
Oh yeah, correct. Because of the hard device that he cannot play too aggressive, huh?
Yes.
Good, good, good. Thank you, Michaela, for sharing. You are here to update us about your father result, is it? Okay, wait. I see you open your video. Let me add. Okay, hi Michaela. Hello. Thank you
No.
for the updates and how old you are, Michaela?
9.
9 years old. Do you help your father to patch?
Yeah.
Wow, thank you so much for helping your father, ah. Okay, thank you, Michaela. Thank you. Take care. Amazing, guys, Someone 9 years old and father knocked out because of playing the basketball, fall down, got a blood clot, cannot remember things, and cannot really speak properly. After 3 days and patching and start to be able to speak better, start to remember things already, and 3 months later, blood clot no more. Can start to speak, remember very clearly things already, and a 9-year-old is helping to heal the father by putting the patch on his father. Without any expensive or dangerous surgery on the brain, by only a patch, you don't need a 30, 40-year-old professional specialist. You just need a doctor that's care enough to put a sticker on you and you get healed already. Do you think that this is an amazing time? Do you think this with LifeWay, this is an amazing time to really live without any fear? If yes, type 555. If yes, type 555. That we can even empower a 9-year-old daughter to help to bring his father life back, Amazing or not, guys? Guys or not? You think amazing, type 555, Crazy, right? Aiyo, amazing. Okay, come. Let me continue. But guys, this is not a small thing, Someone got the blood clot without any surgery, right? By putting the patch, he can start to remember things in 3 months' time and then is able to get rid of blood clot. So this is a testament to tell you, don't worry about blood clot. As long as you are still able to function, the blood clot will disappear. The blood clot will not get bigger. With time, it will get dissipated. It's just a matter of fast or slow. Is it dissipate fast enough before it become a problem? But with LifeWave, right, that is always the top priority to get rid of the blood clot in the brain. Jessica, Jinlong, I've been using LifeWave for 4.5 months for my TED and osteoporosis. I'm now on X39, Eon, X49, Alavida, glutathione, carnosine E. I'm still having gastric, watery eyes, subconjunctiva, hemorrhage, constipation, no change in energy level, often feel sleepy. Can I do CIP? How many cycles? I don't encourage, If you patch so many, okay. Okay, to be frank, if after about 5 months already, you should see much better changes already. You see someone 3 months, even blood clot disappear already. If someone 3 days can become got appetite, 4.5 months, 5 months, right? We expect much better changes. So don't worry. I'm here to help you to dig up what are the things that's stopping the LifeWave for giving the miracle. So Jessica, can you unmute yourself?
Hi, Jinlong.
Hi, Jessica.
Hi.
Is this the first time you come to Zoom?
No, not the first time. In fact, I've been listening to your recorded Zoom all the way from back to January 2025.
Wow,
Very
amazing.
familiar. Yeah.
I see. Okay, so I want to ask, the first question is always, after patching for these 4.5 months, right, what are the biggest changes that you have seen?
I've seen a lot of positive changes. The initial, probably the first 1 month, 2 months, 3 months, but then things start coming back after 3 months.
I see. Okay, so what are the things that have come? What are the things that have been very good for you for the first 3 months before the coming back happened?
So, okay, firstly, I have actually removed my thyroid 2 years
Okay.
ago.
but
Okay.
I'm still having thyroid eye disease, which is the TED.
Oh, I see.
Yeah,
Oh,
but
okay. So they mean
yeah,
your eye is like popping up, is it?
slightly, and because of my TED, I used to have watery eyes, but the watery eyes stopped immediately after 3 days after patching. And
Amazing.
then the pressure on my eyes also reduced tremendously.
Right.
Until today, the pressure on my eyes is gone, but the watery eyes is on and off.
Okay. Understand. Did
Yeah.
anyone say you look better?
Oh, yes, yes. You don't need anyone to say I see myself in the mirror because
Okay.
I have TED. I'm very, very conscious of
Conscious.
my face. So it's really, really very good results. My skin is so much smoother. My whole face is lifted.
Wow, amazing, amazing. Okay, so that
Yeah.
means I can say that this problem like the gastric constipation problems, the first 3 months you have seen all the good changes. They mean the first 3 months
Yes.
the gastric has stopped, the watery eye has stopped, the eye pressure has stopped, the skin get better, the poo-poo is better. It's only lately then it return back. You start to have gastric again, watery eye once in a while, and constipation come back.
Yes, correct. My gastric, especially my gastric lately, I don't know why my gastric has been like yesterday, middle of the night, suddenly the gastric was so pain.
Yeah.
And then it's like I have it like a week ago, I have it, and then so I do not know why, but after patching, I actually my gastric problem has actually stopped, but it
Yeah.
came back. And then also the conjunctival hemorrhage,
Hemorrhage.
that's the bursting of the eye vein.
Yeah.
Before when I was having my thyroid before the surgery, I
Yeah.
used to have this eye burst like very frequent, almost every week or every month. So it
And now?
stopped already after patching. But then lately, after 3 months, I have like 3 occurrence, but
Yeah.
it's not very, it's mild break off of the vein, very
Right.
mild.
Right.
Yeah. And then my constipation, I used to have once in a while constipation, but not so bad. But somehow the constipation, like I'm having constipation now.
I see. Okay. Okay. I roughly understand already. So apart from the look getting better, do you find that your hair, your nail growing faster, harder, your hair growing faster, less hair loss?
The hair, because of my hair, I haven't noticed anything yet, I think.
Okay. Okay.
But the other
Understand.
positive thing I see is that I used to go to to pee every night at least 3 times, but now maybe once or none.
Wow. Wow.
The night urination is soft lah.
Wow, amazing. That's very good for you. Okay, so Jessica, I think now is the second phase of healing. So this is why your gastric it will come back again. So regarding the watery eye, right? So there are always different phases of healing the eye problem. Do you find that you have a lot of discharge apart from the watery? Do you find they have more discharge like those
No,
yellow colourish sticky? Do you have this?
don't have.
Don't
It's
have
it's always it's always the clear watery eyes.
Okay,
Yeah.
okay. So, for the past maybe 1 month or so, where you start to have this second round of healing reaction, do
Uh-huh.
you do anything like you drink less water, you go travel, you eat a lot of durian, you drink less water and things like this? Any change of lifestyle?
No, not I didn't. It's the
Didn't
same. In
ah?
fact, I've
Same ah?
increased my water intake. I've been eating a lot of white rice.
Okay,
In fact, I
okay,
put
okay.
on weight already. I want to ask you how to reduce back.
Okay, don't worry. This one later on is going to reduce. So I just want to confirm you have removed your thyroid, right?
Yes, removed totally. 2 years ago.
Okay, is it because because doctor say you got thyroid problem, so you drink the iodine?
No, it's because I have been having hyperthyroidism for 2 years under close monitoring and medication, but still cannot resolve. So and then it affected my eyes. So the doctor asked me to remove.
I see, I
Yeah.
see. Okay, so if now if you think back, right, during that time when you got the hyperthyroidisms, do you have many digestive issue? Are you eating enough?
Yes. I mean, I have stomach ulcer.
Alright,
I have not been eating rice. I eat, I think, less than half a bowl a day.
every day. Okay,
I
okay,
didn't eat rice.
I
So
see.
yeah.
It's okay. If you can come to the Zoom 2.5 years ago, how
Yeah.
lucky, right? Don't worry.
I cannot turn back time.
The best time is 2.5 years ago. The second best time is now. Don't worry. If you have seen a lot of good changes, actually you are quite lucky because for people who get their thyroid removed, right, normally they don't see results so fast, one.
Usually, how fast the
Okay.
results will be?
How old you are?
52.
52, about maybe I would say 5 months time. And if you got remove your thyroid, it take 10 months. But now you only half months that you have seen some changes in the beginning already is a good thing. But your ups and downs is going to be very different than normal person because you remove the thyroid already. The body is not on the highway. Let's say I go from Singapore to KL, they cannot took the plus highway because the plus highway has been broken, no thyroid already. So he had to go elsewhere to find the ways. So your healing cycle is going to up and down, but overall, you will see that the frequency reduce. Later, it's going to increase a little bit, then it's going to reduce again, then it's going to increase a little bit and reduce again. It's like that.
Okay.
Yeah.
What about the energy? Like my energy level, because I've listened to so many testimony about them having so much of energy, but I
Okay.
don't have that
Understand.
the good energy level, and I often feel very sleepy.
I see. When you feel sleepy, what are the timing that you feel sleepy? Is it at the late afternoon?
Late afternoon, yes, late afternoon,
Okay. So
yes.
if you happen at late afternoon, right, that means your kidney is not strong. So do you find that compared to before the patch, you can hold the urine longer? Let's say last time when you drink water, maybe 1 hour plus, you need to go toilet already. But now you seems that in the daytime you can hold the urine longer.
Yes, I can hold the urine longer. In fact, I have this problem. I have uterus prolapse.
Yeah.
So but now it seems like I think
No more.
it's like when I it's like soft, probably 70% or 60%.
Amazing. So, and the reason now you feel sleepy at the late afternoon, right, is the body want to heal the kidney during that time. So, if you want to solve this problem, you have to sleep that time. So, this is like for example, if I don't give my son the toys, right, he will keep on nagging, he will keep on crying one. Then I say, why you keep crying? Why you keep crying? But whenever I have a toys that I don't want to give to him, hey, why you keep crying? Why you keep crying? Same thing. The reason your body it feels so sleepy is because your body wants you to rest during that timing to repair the organs. But you don't sleep. And then you
I need to work, ma.
understand. But
Uh,
this body come first. You just take maybe just a few maybe couple of days that you just need to pangkang earlier. Pangkang means if you just finish your job earlier, go back home earlier, just take the half day leave for a few days really have a good sleep. 2-3 times you got that already, right? You will not feel sleepy already. So now the stumbling block is the body just need that little bit of sleep during that time to heal, to complete the job, but you are not allowing them to do. So this is why it become a stagnation that your body cannot repair the energy cycle.
so the sleeping time, you're saying that for the kidney to heal, it's from what time to what time? Afternoon? Do
Okay,
you
late
know
evening is late
on
evening.
late evening?
Late evening.
Oh,
Yeah.
okay.
So that means if you take half a day, I think is a good time. Just maybe take 1 to 2 half a day, really take a good nap. It will be a very power nap. You will realize, "Hey, how come I sleep only maybe half an hour, 1 hour? I wake up so energetic, and then tomorrow sleep half an hour, then one more day sleep about 15-20 minutes. Then I don't need already. Then your body energy system start to restore by itself
Hmm,
already."
I see. Okay.
Yeah.
Do
Okay.
you
Wait,
have?
Okay,
Okay,
Jessica.
yes.
Why I need you to follow the advice of taking a nap? Do you feel surprised that without you telling me, I know that you cannot hold your urine previously?
How you know?
Strange, right?
Yeah.
Because those people who feel sleepy at the late afternoon or late evening, this
Oh.
timing, right? It means that the kidney is weak. When the kidney is weak, it cannot hold urine. So this is the telltale sign to tell you your body is indeed want to have more sleep to complete the healing cycle.
Okay. Okay. So
Okay.
the patch, do I patch on the spot where it
Don't
relates to
need,
the
don't need,
kidney?
don't need. Whatever you've been patching is working already. What we need is just to sleep. We need
Okay.
that timing to sleep. I give you examples. Okay, you know like sunflower, sunflower, right? Only when the sunrise, then it will start to rise, right? Sunflower. Okay? But every time, let's say from 8 to 10 a.m. is the best time to put the sunflower outside. You purposely don't want. Say, I'm very busy lah. I got no time to put the sunflower to the sun. So every day you complain, how come my sunflower always so lembek one? Never stand up. Why? Then you say you had to go out 8 to 10, then you will automatically wake up. Then you say, cannot lah, I'm working, I'm very busy. So this is what happened right now. You just need to give the time, even just 2 hours period, right? For the sunflower to capture the sun, that 2 hours is going to change the game already. You just wait that 2 hours. Same
Yeah.
thing like your net right now.
Okay, understand.
Okay, don't worry
Okay.
about the CRP. Don't worry.
So do I continue with all these batches
You
or
can,
just
if you are seeing good changes, you can continue, no problem. Just remember, my job is always for you to focus X39 Eon. If now you
okay.
see changes already, at least 3 years time. Don't care about anything, whatever you feel, just go 3 years time. Remember to document down your testimonial
Okay.
for the past 3-4 months. They will come to the time because you got thyroid removal already. Your body
Yeah.
need to do something to re-regulate the hormones. And during that time, maybe 2 months, 3 months, you don't see any changes suddenly because you try to find a new pathway to regulate the hormones. You might feel disappointed. You might give up. Then you give up already. When you come back again, the body need to re-heal again. I give you
Yeah.
examples. Let's say now from Johor to KL, this is a plus highway. But now the highway collapsed already because you remove the thyroid. So he had to look for any shortcut bypass. So now he tried to find a shortcut until Malacca, until Seremban. Finally want to reach KL already. But as you look for the shortcut, your car cannot drive yet, right? So you think that how come my car still cannot move? No, I don't see changes. So you stop patching. But those shortcut that you have developed for the past for that few months, right? It will start to have bushes to cover up again. And then when you restart the patch again, right? The life phase later, when you decided to try again, right? Then they had to rebuild the shortcut again. So I just want to give you a confidence. You are seeing changes right now. These patches definitely work. And what you need is just have faith in it. Continue to patch. For me, remove thyroid 5 months times 2 is 10 months because you are 50 years old. And they will come to the time you feel disappointed because how come I got no result already? Because your body try to regulate the hormones. But that time is the time that you have to continue to push through. And I can assure you, because now you're only 50 years, 52, is still very young. If you don't have thyroid already, if you still don't have a power bank, it's just like our phone, right? If my phone no more battery, I need a power bank to support, right? Always, right? Same thing. Now you got no more thyroid already. You need a power bank to support. This power bank is life patches right now. So I've seen so many people after they remove thyroid in the early days, 40 over years. So when they go to 50, 60, right, they got heart palpitations, they grow old so haggard so quickly, their hair turn white so fast. Because without the thyroid, without the good metabolism, the body cannot build collagen already. Suddenly get so haggard. So this patch is what you have right now since you don't have thyroid already to keep your body always in a good shape.
Okay, yeah. Jinlong, do you have have you heard of any testimony on reversal of TED? Anyone have?
Okay, it's
reversed
for
before?
TED is not a big problem. TED is not a big problem. When the reason you got TED, right, is because your body is let me give one example. Okay, I'm going to say this way, right? So if today I have I have what do you call balloon? I have a balloon, right? So when I blow it out, it will get bigger. Okay. If this balloon have a small lobang, have a small hole over there, right? If I keep blowing very, very hard, this small lobang, it will suddenly burst out. It will suddenly burst. Same thing like human body, right? Because you don't have thyroid. Okay, that time when you got hyperthyroidism, right, it means that your body do not have enough calorie. You are not eating enough. You have bad digestion, so you got stomach ulcer. So your body need to use hormones as a secondary engine to drive out the metabolism. So as it drive out the metabolism, it try to pump heart faster to run the blood around, right? So eye is the only one of the opening. So inside there, imagine behind there so many blood vessels, right? When it try to push more blood over, it will try to push your eye up. So later part of the after use life for quite some times, right? I've seen quite many cases. I tell you, not even TED. I got some people up to the time, right? This eye is keep on turning one, you know. The eye keep on turning one, you know. This one looking, you know, this one keep turning one. Also can count him.
Oh, okay.
Okay, so don't worry.
Okay.
This thing is going to happen. Just remember the
Okay.
rice. Don't worry about fat. One bowl or two bowl is perfectly fine. If you really worry about fat, can do some slight exercise. Don't run. Don't over sweat. Just do some so do some walking. It's good enough. Get some sunlight. It's good enough already.
Okay.
But most important thing is not exercise. Most important is the sleep first. You have to sleep enough for the body to really do this. I believe that before the patch, during your working times, you also someone who lack of sleep.
Yes, I couldn't sleep. I have never been sleeping so good and so soundly until after I started patching. So my
Amazing.
sleep has been like so quality.
Oh my goodness, I'm so happy
Yeah,
for you, Jessica.
it's very good.
So
Yeah.
yeah, so
Yeah.
please, when you see these changes, you have to document down your story,
Yes.
document down your before after, and then later on, you are going to help your friends around you because there are a lot of people that is you 2.5 years ago. They are thinking,
Yeah.
should I remove the thyroid? Imagine this, if you never remove the thyroid and then you make life with, can you
Yeah.
imagine? Can
Yeah.
you imagine?
Fated
Okay,
lah. Yes.
hated lah,
You
it's
know,
okay.
yeah, so sorry. My
Yeah.
husband is also a user.
Yeah.
I have managed to convince him to use. He got questions. Sorry, hold on.
Come. Sure.
Sorry, I just tumpang only.
No problem.
Okay, I've been using this X39 and Aeon for 3 months.
Yeah.
Okay, of course, I have those positive sign.
Can you
Okay,
tell me
now,
what is the sign? What's the positive sign?
okay, the positive sign is okay, because last time I do have this. I mean, okay, I recover from a very bad eczema.
I see.
Okay, so then because after the recovery, there are a lot of like those dark dead skin on my face lah.
Okay.
So anyway, after using it, my face look lighter. I mean,
Yeah.
yeah. So that means those dark and dead skin already cleared lah.
Right. Oh my God. Okay.
So looks fairer lah, fairer. Okay, then of course my sleep is so much improved lah.
Right.
Okay, these are the positive thing.
Right.
Now I'm still monitoring whether my hair is really darker lah.
Right.
Okay.
Oh, okay. The reason you say like that is because someone say it get darker, is it?
Yeah.
Okay.
Because
That's good.
yeah, my mom somehow noticed lah, but
Wow.
uh,
Okay, if your hair getting darker, it means your kidney is getting stronger. That means your night
Oh.
urination also reduced already.
yes.
Hey,
Okay,
amazing.
actually, I'm not sure whether it's a healing crisis or not because last week, somehow I having this urination every half an hour.
Okay.
Every half an hour, I have to go to the toilet.
Okay.
So okay, and then then after that I got fever. Then the
Yeah.
doctor say it's a viral infection, something like
Walao.
that lah.
Okay.
Okay, so okay, after the healing crisis, I find because the past 1-2 months I used to have like my back is like very 心痛
Yeah.
It is not backache, but it's like you feel very uneasy, like you're sitting too long, then you feel a bit of strain kind of thing lah.
Right.
So after this, somehow the frequent urination and then after the fever, I find those strain on my back is gone.
See, okay.
Ah,
Okay. Then I can tell you why. I think your body got some water retention issue.
I
So
see.
probably it's a kidney. Your kidney wasn't
Kidney.
functioning well. So kidney in charge of water. So this is why you pass a lot of water. Do you find that after you got all this kind of discharge of water through urine, right? Your
Yeah.
body is slimmer, your joint, you don't see so much of like retention already?
I mean somehow like okay, I think my leg I
Yeah.
can see my leg I can see
The
those
bone.
vein
Yeah.
the vein and the bone like cleaner, like
Yes,
more
you are
lean.
right. You are right. So those water that you feel that how come I never drink so much of water? Why come out so much one? Is
Yeah, right.
it's all the water retention in your body. Your kidneys wasn't functioning well. So it can be your heart also. It can be your heart also. So
Okay,
those water is trying to repel out. So
I
this is
see.
why I believe after that, right, your heart also feels stronger. You can speak longer, you can walk faster, you can walk longer, stamina better.
Okay.
Yeah.
Okay, actually, my questions to you
Oh, okay, come.
this is not the okay.
Oh,
My
okay.
question to you is okay. Actually I want to try this patch whether can really reduce my cholesterol level.
Can.
Okay, so I have tested. So over the past 3 months
Yeah.
okay, I used to take this blood thinning and the rovastatin. I mean the statin
Right.
as prescribed by the doctor lah.
Right.
So the blood thinning is 75 mg and
Right.
the statin is 20 mg.
Okay.
So the past 3 months, I reduced the statin to 10 mg.
Okay.
Okay, but of course the blood thinning I still continue lah.
Okay.
So today I got the result for my cholesterol.
Yeah.
Okay, the
Triglyceride.
That's right.
okay has reduced from 1.22 to 0.79.
Okay.
Okay, the total cholesterol still maintain the same lah, about 4.4.
Yeah.
Okay, the good and bad, the HDL and LDL also almost the same lah.
Okay.
So, okay, the good thing is I can see even I have reduced the statin to half.
Yeah.
The total cholesterol same,
Yeah.
but reduced in the triglycerides.
That's right.
Yeah.
Which
Okay,
is
now I
important.
want to test whether should I stop the blood thinning
Stop. Okay.
or
Are
another
you
3 months?
are you
Yeah.
on any are you on any stents or not? Are you
No,
have
no,
stent
no,
or
no.
balloon and no
No,
So
no,
the reason you are on
nothing.
this drug is because of cholesterol is high, right?
Yes. Okay. The reason I
Okay.
started this one is
Understand.
because the doctors I mean did this what last time they called it the calcium score.
I see.
Okay,
Oh, okay. Understand.
so he said the calcium actually is very mild lah, 0.5 reading.
Yeah.
But he asked me to take lah. He said since your age is like that, you might as well
Yeah.
just take and then continue your normal diet. Yeah.
Since your age is like this, might as well you take. Wow, piang eh. The doctor can say this kind of things one.
Really. He said you don't need to like worry about your food. So just continue your normal lifestyle. Wow. So I've
Walao
been
eh.
taking this for almost I think 5 years already.
Oh my goodness. Okay.
Yeah. So
Okay.
now I want to try whether this patch can help me to really go without the statin and the blood thinning.
Okay, I have a lot of confidence. As long as you do not do any stent, they mean you
Yeah.
are not using the cholesterol for the stent to work, right? Then it's very safe. So since now, but just remember when you reduce, right? I think 3 months is a good period. Since you have been reduced for 3 months, you are feeling perfectly fine, and
Mm-hmm.
you can really do your own way.
I see.
Yeah.
So
it will be fine because at the beginning, the reason you eat this, right, it's not because you got problem. The doctor just say, why don't you just eat as a precautionary measure rather than to heal certain problems. So I think if I were you, I will try to stop it also.
I see. I
Yeah.
see. Okay. Okay. Thank you. Thank you.
Yeah. Okay. And one more thing,
Right.
sir.
Yeah.
When you stop all this cholesterol, right?
Okay.
They mean for the past 3 months, right? You stop the cholesterol pills.
So I
Sorry,
reduced to half.
reduce to half, right? Okay.
Yeah.
So when you reduce this half, right, do you find that you can breathe better, you can walk a longer distance, your memory get better?
I think yeah, a lot of this sign is I mean what you have mentioned I mean not really like, but I can see the stamina is better.
Improve.
Yeah,
Okay. How
improve.
about the memory? Do you find I can remember things better? Last time always forget this, forget it. Now I can remember things better.
But the memory is because of his patch.
Sorry?
The memory, I think he told me that he got better clarity in memory. I think it's because of the patch. He has been
Right.
using the patch for 3 months.
Yeah.
Oh, you mean
So
the cholesterol will cause your memory loss one?
yeah.
Oh,
Yeah,
I see.
and this one of a very common side effect, like statin, blood thinner, all these kind of things, right? That they try to control and reduce your cholesterol, right? Ultimately it lead you to memory loss also.
Oh,
Okay, so
I see.
so it's because okay, if your memory has been fine, right? When you put the patch, right, it will still stay clear. But why is it that last time before the patch your memory is not good? It's because of the drugs. So now
I
life
thought
you
I
try
thought
to
it's getting
replace.
old.
Oh no. How you your wife only 52, I believe now you're 55?
53.
Oh, even young where got 53, where got so fast. Oh, 53 just starting already. We live until 150 years old, you know. So you are 1/3 only. Where got oh.
That one is Moses time.
Oh no. This is life with time. David say we can live out to 150 years old with all the technology that he's going to show us.
Okay.
Okay, okay. Thank you.
Okay.
Take care.
Thank you.
Bye.
Bye.
Hey, there's a lot of things to learn in this conversation. I hope you guys capture. Let me summarize. So for example, the first one, the Jessica got thyroidism. I always say anyone got thyroidism, what is the issue? Anyone got thyroidism, what is the issue? Thyroidism. Okay, sorry, you all can answer for your own reference, but I want to tell you first because no time already. If you got thyroidism, right, is our body have two operating system. It's just like a hybrid car. You got pump the fuel and you use the electrical battery. So when you are not pumping petrol, your car need to use the electricity from the battery. Our body also like this. If you are not eating enough, the food used to burn the sugar, burn the food for energy. But when you do not have the food intake for energy, your body need to use metabolism, use hormones to increase the metabolism for your body to stay active. So this cause hyperthyroidism. For people who are healthy, your organ is strong enough to withstand the pressure to increase the metabolism, you'll get hyperthyroidism. But the moment your organ give way already, then it become hypothyroidism already. So if someone have a hyperthyroidism, right, for quite some time, like 5 years, you can say that you have a very healthy body. Okay. If I ask Jessica to unmute, she will say, yeah, my body compared to other people, I'm quite strong one. Always like this one. Because she can hold that metabolism by the hormones and yet not the body not give way yet. If I got hyper, maybe 2 months I got hyper already. My organ give way already. This is very important, guys. No one know about this. So most of the time, the digestion problem. So she says she got stomach ulcer. She never take rice on. She's not eating enough. Okay. And because of this, the energy is not enough, the sleep get impacted. But after patching for 3 months, imagine the face lifted up, the skin getting better. No need other people to tell me, I know I get better, I look better, my face lifted up. My watery eye reduced a lot. Now come back a little, but there was a time that now the eye pressure reduced no more. watery eye comes and go, gastric recently only start to happen, could change. And one important thing is that how come I got no energy, but I often feel sleepy? If you have seen so many changes and yet you feel sleepy, it means that this is another healing symptom. That means if it is happened in the late afternoon, evening, it's always the kidney want to heal. So because he tell me that he feels sleepy at that time, they mean the body have been trying to heal kidney already. There are certain signs of weakness previously. So I asked, so your kidney is weak. Are you someone very cannot hold the urine? Yeah. I very hard to hold urine one. Now improve about 70%. Yeah, how come you know? It's because that is the time that your body is healing. Okay, so when he's try to sleep, take a nap during that late evening, when he feels sleepy, go ahead to sleep, right? The energy level is going to go up. Okay, I hope you guys learn. So the second thing is her husband. Eczema problem, I don't know how many years already. After putting the pad, those scars have disappeared or drop off now, skin fairer, happy couple right now. And stop the medication for 3 months. And yet the cholesterol remain the same and the triglyceride reduced only by patching. So for those of you who think that medication is the only way to heal, who say he had been taking medication for so many times, the triglyceride never dropped down. But now reduce the medication, add the patch, the cholesterol remain the same, but triglyceride, which is much more important indicator, reduced. Guys, think about this. And why I asked about memory, because I need to use other people's mouth to tell you the side effect of all kind of cholesterol, blood thinner, statin, because all these things you're trying to play around with your hormones, try to play around with your cholesterol. But cholesterol make up the bulk of our brain to store information, to protect the neuron so that our neuron don't short circuit. So when you have this kind of drug to control your cholesterol, it means that here also get affected. Your memory always get weakened. So when you put the patch, you will start to see your memory get better, only with the circumstances that you're used to not operating at your best memory, right? That is because of the drugs. So now you stop the drugs already. If you don't have the patch, if you stop the drugs, it will still heal, but very slow. If you stop taking the cholesterol or those statin or blood thinner, right, your memory will come back, but very slowly one. And you can't notice. Maybe say for example for her case, maybe take about 1-2 years one. But life wave 3 months, boom, come back already. This is the power of life wave. We are only expedite the nature intended way of healing without doing any extra. We all just want to speed up whatever has been designed here already. Amazing, guys. You guys learn a lot from all these things. If yes, that 555. If yes, that 555. And okay, and one more important thing. And just now Jessica's husband say about I go one time I pass out a lot of urine, every half an hour. And then the soreness at the lower back. I think it should be a lower back because lower back is where the kidney there. So when the kidney hold a lot of water there, because it cannot dispel the water, it feels sore. So when you move, the water will circulate so you don't feel sore. But when you sit too long, the water go to the kidney, the kidney have no way to expel out. So this water will all retain at the lower limb. So you will have you can't see your vein at your calf. You cannot see your bone at your leg because the water is there. So when the water start to dispel out, no more soreness. And I asked, do you find that you can see your leg better, see the bone better? Yeah, now I can see my bone better already. Because the body remove all the water already. Amazing, guys. You think it's amazing? The amazing is, how can I every time, before people ask me, I can already tell that the bone, you can start to see the bone already. Yeah, how come you know? You can start to feel, Jessica can start to feel you can go, you can hold urine better. Yeah, how come you know? This is not I'm smart, It's just by experience, because this is how the body works. You just need to take some time. Imagine what the doctor say. Thyroid got problem, never ask you whether taking rice or not, whether asking you, are you eating enough? Don't care. Remove lah. Since take the medication, you don't get better, remove lah. This gentleman, the doctor say, since just take lah. Then you can eat whatever you like already. You don't need to worry lah. These kind of people call doctor, Do you feel afraid? Do you feel very scary? This kind of doctor, it's okay lah. Your indicator is fine lah, but calcium a little bit like this, the calcium score not so good lah. It's okay lah. Why don't you take the drugs lah? Drugs supposed to be the last but not least way, because it's drug, is a chemistry, is still a toxin. But the doctor can take it so lightly. I might as well you take lah, then you don't need to worry lah. What the freak, man? Scary or not, guys? Scary or not? If you think it's scary, type 999. Remove lah, thyroid lah. Since you take drug, no effect, I remove lah. Later you eye pop up lah. Never ask you got eat enough or not. Never ask you got stomach problems or not. Because they don't know. They cannot connect that thyroid is with stomach. Take drugs lah. And now the memory loss. Later you got dementia. You got brain fog. You go to see the doctor. The doctor say you got dementia. You got Parkinson already. Then you take another form of drug. Never know that it's the cholesterol drugs. Is really putting the seed in you to erode your body system. Okay, anyway, let's continue. Bona, I have a question regarding my brain partner. He's in hospital toe have no feeling, lower calf have turned brown. Doctor want to amputate his toe and take antibiotic. What do you suggest? I asked the Can go ahead, Bona, go ahead. Okay, you can put more X39. You can put more S39. If it's really urgent already, you can even put just put more S39 lah, like glutathione, carnosine, ion, right? The 3YH can patch together. Okay, you can just patch together. You can patch together. So morning S39 around, and nighttime you can put all the YH. Okay, I have a lot of confidence we can avoid the amputation. You guys, you see, turn brown already. Cut lah, amputate lah. Don't even ask what is the reason causing the brown dead toe at the first place. This is why I want to show you. It's not about the doctor it's not about what is the diagnosis. The doctors diagnose, find out the symptoms, and how detailed they find is always playing around the symptoms. They never pay attention to the root cause of the problems. At least understand that we should be drinking lots of water besides taking white rice before we could find effective in our patching. However, it's rather disturbing to note that in the Super Wednesday presentation, the presenter keep on time and time emphasize to drink mineral water instead of not plain warm water. In this case, we should be buying or stocking up mineral water in our home. Kindly enlighten us which is the best way moving forward. Thank you so much. Okay, so the idea, the mineral water is the right advice. Okay, mineral water is a good way. That the water with mineral. So try to stay away from the purified water. Try to stay away from the reverse osmosis water. Okay, so that means, right, you can drink warm water, but that warm water, if it is the RO or purified water, then we don't suggest. Okay, so having said that, mineral water is the optimal way. But if your home have a normal water filtration system, there is no RO, no purified, it is fine also. It is fine also, at least. Jinlong would like to share, I recently went to Japan for 1.5 weeks and had to switch up my diet and eat a lot more white rice compared to what I have been eating at home due to insulin resistance. I was doing my second CRP during the holiday too, but didn't experience my healing crisis. Just 2 days after returning from Japan, I went to see my TCM doctor for my regular checkup. She was surprised to find that my pulse was stronger. Before she said my pulse was weak, I believe it was eating more white rice. Bingo! Guys, amazing or not? This is why sometimes, right, I push you guys to hear. You think that I eat a lot already. Actually, not a lot. Not a lot. I eat a lot. I listen you every day. I eat a lot. How many? Half a bowl already. Last time I never eat. Now I eat half a bowl. Try very hard half a bowl. Still not enough. But things like this, it tell you my enough to you is actually 1 to 2 bowl. But you guys think that average 1 bowl. So sometimes half bowl, sometimes once in a 1 week I take 2 bowl, okay lah. It actually no okay. The optimal way is still more than 1 bowl. 1 bowl means the chop minimum 1 bowl. But people always want to take shortcut ma. Amazing or not, guys? Go to Japan, the country where have a longer lifespan, ended up eating more white rice. It means that white rice is good. This is why those people are eating. And the second thing is when she come back, because of taking more white rice, now come back, the pulse becomes stronger. They mean the TCM said the qi become better. Do you think that I still need to tell you any more? Because even he have felt that the Japan eating more white rice, they are longer living a race. And now we have a TCM said your pulse getting stronger. So Wendy, I think you are also the one who don't eat white rice at the beginning, right? Now you see the magic. Amazing. Okay, so Jinlong, what pet did Michaela father use for blood clot in the bed? Okay, don't worry, Caroline. Maybe Michaela and Margaret, maybe we arrange sometimes arrange you guys to come to share. Is it okay or not? Is it okay, Margaret and Michaela? Maybe you put some photo and then we let Michaela do the sharing. 9 years old come to do the sharing. Anyone want to listen to a 9-year-old Michaela to do the sharing? If yes, type 555. If yes, type 555. So awesome, Michaela. My 5-year-old boy look forward to his daily night patch after shower. Our next generation is excited when they are healthy. Yes. Maria, we are going to make this happen for our generation. Charmaine Ong, my BP let her cousin try LifeWay who had cataract problem. She vomited after patch Eon and carnosine just for one night. Based on the ChatGPT, okay, no, let me tell you, those who had cataract problems, right, they mean the body circulation is bad. If she vomited after putting the patch, right, it means that the stomach got some residual things that have been stuck in there. After she vomited, you can ask, do you feel that your stomach feel empty? Not so bloated? And then you open up the appetite. This is the key. Don't need to follow ChatGPT one. You know, at the beginning of ChatGPT, when people Google me, who is Jinlong? Because people say Jinlong. So they Google Jinlong, you know. They talk about 当不成医生的工程师. You know what they say about me? They say that Jinlong is someone who got cancer at 20 over years old. Stage 4. So guys, ChatGPT is a good artificial intelligence, but I think even the founder of ChatGPT is saying that ChatGPT is supposed to be a reference, but now we are taking it like a truth already. Guys, the real GPT is here, okay? Don't need to follow ChatGPT. Jinlong, the message was sent 8:30 by Melvin. Okay. I've been using Alavida eye cream and Alavida patch together with X30 and Eon since March this year. I do not see any improvement in my puffy eye. What should I do? Does taking alcohol affect this puffy eye? Okay, if you drink alcohol at night, yeah, it will happen because the liver cannot rest. So 2 weeks ago, I did CRP for 5 days and it helped my sleeping, energy, calmness, and appetite. How long should I do? That is good for you. If that is the case, I think that either you are not drinking enough water, you're not eating enough, so the result is a little bit slower. After you do the CRP, where he give a full bloom, right, then you start to see the good changes. So we start with the 15 days first, the CRP do the 15 days first, and then we see how it goes, okay? And then we think we want to go for the second round or not. Normally, in the first round, you see good changes, it should be fine already. But for those people, the first one round, especially until the last one, maybe the last 2-3 days, you still can see that you are still have more and more reaction coming. That means that now the body is still in a progress of healing, right? Then you don't stop. You continue for another 15 days to make up to 30 days. Okay, but in the 5 day, 10 day, you start to see the changes that are coming up. The last few days, it start to subside already, calm down already. Then it's okay. You can keep it to 15 days. Irene, where to patch for a person? Okay. Wait, okay, wait, I forgot to screenshot a few things. Okay. Okay, let me see. Okay, that you're right. Very slim, I pop up. Yep. My mom had a heart stent in one of our arteries. Yeah, Jane is safe. LifeWay is the only medical device that is safest for people have stent. Because if you use any kind of energy device, right, it is not going to be helpful to them. Okay, it will going to disrupt the rhythm of the pacemaker, and sorry, the heart rhythm. Can I pop out from hyperthyroid and go back to normal if need how long? We don't know need how long. We do not need how long, but it's definitely is going to happen. Jinlong, if someone backbone this slightly move out and has slight pain when walking too long, what can he pay to improve the condition for 2 years already? Okay, Margaret, you go to our builder hub. You go to our builder hub. Okay, let me show you. Okay, let me show you. I'm going to show you the... Okay, this one. So, this is what we do. So, you read through this post, spine is the cause of leg pain. They mean if people after putting the pad for 2 years still pain, it's definitely there's a decompression. Maybe it's the lifestyle and how he work. So you see, this lady is Madam Cool. After putting the patch EE at the right location, please read through this, okay? Then you will know where to patch. She said it's miracle. She said that it's miracle. I can now stand without feeling that pain anymore. So, and one member share, Shima. Yes, Jinlong, I'm very thankful that you show me how to patch correctly with the right patches. I was patching daily with 3 pair of ice wave daily to combat with the pain, but the pain persisted. The pain is always there, even when I lie down. I was truly at my wit's end trying to get rid of the pain. When you helped me to patch me with just a pair of EE at the area where the pain is mostly felt along the spinal area, patching the way you described above, my immediate response to it upon walking was I felt I grew taller. After the next impact, I felt the pain went away. It was truly amazing that day, and today I'm mostly pain-free and I can walk longer distance already. Thank you, Jinlong. Amazing, right? So this is what you can do. This is what you can do, Margaret. Go to the Builder Hub. Okay, drug care, not healthcare. Wow, this one remember my words. Drug care, not healthcare. How about alkaline water? Because we have the hydroflux dispenser. Alkaline water is fine, but you don't keep it more than 9. Just below 9 is fine. Okay, Jinlong, for example, I'm helping my BP to save his toe. Yeah, let's do it. We can save. Okay, yes, all along control my rice intake cause of it. Yes, Wendy, this is why I know. This is why you see, because the understanding is very different. For me, here is enough. Here is not enough. But for you guys, here is okay. Not taking is okay. So here is a lot already. So at least you follow my right to eat a little bit. You are going to see some changes. They will come to the time that like a Japan trip that enlighten you. Oh, what Jinlong said is like this. Then you are going to go up. It's okay. I have patience. Okay, I'll be able to join you again tomorrow night. Okay, sure. I'll have to leave now cause tomorrow. Okay, no problem. Yes, all control. Yeah, this. Well said about ChatGPT, our creator given brain. Yes. Okay, thank you. Okay, let us wait for Margaret. Let me write down Margaret first, okay? Okay, Margaret. Okay, wait. I'm going to give you a link. Margaret. Okay. Wait. Testimonial. Where's my link for testimonial? Okay, wait. Margaret. Okay, guys. Today is it only Margaret? Okay, wait, guys. Wait. I got something to share with you guys. Okay, Margaret, can you help me to fill out this form? Can you help me to fill out this form? Margaret, help me to fill out this form. Your name and contact, and then we'll contact you. So, guys, tomorrow 9 p.m. we are going to make history together. Tomorrow 9 p.m. we are going to come together as a team to send a farewell to our beloved country manager, Mr. Casey Howe, at 9 p.m. So every one of us will gather together. 8:30 still the Zoom. 8:30 still the Zoom. So we'll discuss Q&A as per usual. And the Chinese session, they will join in the English session also. And at 9 p.m., we will start to do some organizing so that hopefully we can get 500 people in the Zoom meeting. And then we'll unmute. Every one of us who can unmute, we unmute. And then we say, thank you, Casey. So we want to capture everyone's sound together at 500 because I know some of you who couldn't attend for the 30th of August of a KC farewell dinner is fine, but at least I capture your voice and I will put it into the video, and this is a gift for KC. On or not? Tomorrow 9 p.m. On or not? If on, type on. On or not tomorrow? Tomorrow 9 p.m. This is the one last time that we can do something for someone who have really poor his P-O-U-R, pour his soul, his energy to us to grow to who we are today. Okay, let us make it tomorrow. Okay, tomorrow still come the same time, 8:30, but 9 p.m. is where we will start to do the things. Okay. Okay, guys. See you tomorrow. Bye bye. See you. Take care. Bye bye.